When last did you check your sugar level? Come closer. Did you know that diabetes and hypertension is one of the leading causes of death in Africa? I guess you're not aware. But let's talk about diabetes. A lot of you have heard of diabetes. We have diabetes mellitus and diabetes insipidus. But the one we're talking about today is diabetes mellitus, which deals with blood sugar. Diabetes mellitus is a chronic metabolic disorder characterized by persistent hyperglycemia. When I mean persistent hyperglycemia, I mean elevated blood sugar, which is as a result of defect in either insulin secretion or insulin action, or both. What are the classifications of diabetes? Diabetes can be classified into type 1 diabetes, type 2 diabetes, or gestational diabetes. In type 1 diabetes, there is absolute insulin deficiency. In type 2 diabetes, there is insulin resistance and relative insulin deficiency. While gestational diabetes occurs in pregnancy, it is usually corrected mostly after delivery. Causes or risk factors. It can be genetic through the gene mutation, family history, obesity. It can be due to physical inactivity and many more. What actually goes on in this diabetes mellitus? There is reduced glucose uptake by the tissues, which now leads to increased hepatic glucose production, which leads to hyperglycemia. What are the symptoms? There are symptoms that are called classical symptoms. There are three numbers, the three P's. We have polyuria, polydipsia, and polyphagia. In polyuria, it means excessive urination. Polydipsia means excessive thirst, and polyphagia means excessive hunger. These are called classical symptoms for you to know, oh, this person has diabetes. Other symptoms include weight loss, blurry vision. Diabetes can lead to different things, which we call the complications of diabetes. In complications of diabetes, we have what is called acute complication and chronic complication. Acute diabetic complications are the complications that just occurs suddenly. Chronic complications are the ones that are long-standing, long-term. When it comes to the acute complication, we have DKA, which is called diabetic ketoacidosis. We also have HHS, which is called hyperosmolar hyperglycemic state. Chronic complication, we have diabetic retinopathy. Yes, diabetes can cause blindness. We have diabetic nephropathy. Diabetes can actually affect the kidneys, which can also lead to CKD, chronic kidney disease. We also have diabetic neuropathy, which means diabetes can lead to nerve damages. Yeah, diabetes does not have cure, but it can be managed. Now, how can diabetes be managed? We have one, lifestyle modification, meaning adjustment in your lifestyle, probably your food, like what you take in. You know that, oh, because you are a diabetic patient, you should be on strict diet. You should do a lot of exercises, some drugs. This does not have cure, but it can be managed. A lot of you are close to death or don't even know that you have diabetes. You necessarily need to go to the hospital to your blood sugar. You can walk into the pharmacist and they can check your blood sugar for you. Let us make hay while the sun shines. Putting on a scrub from Mandy's Medfit. This is actually their Cura set and they sent it to me. I love the material and love everything about this set. If you're a medical student, a nursing student, or any student or even health practitioner that wears scrub, do well to patronize their brand. Thank you.